I'm Dr. Pam Taffera-Deihl. I am the medical director of the hospitalist team at WellSpan Ephrata Community Hospital.
Take me back to a time when you first heard about COVID-19.
I can think of my neighbor saying to me, what do you think about all this stuff? Is this going to be a big deal? And admittedly, I sort of blew it off. But I remember the realization came to me when I made the statement, the loss of life in this pandemic will be immense. And the world after this pandemic will be different than we knew it before. In the beginning of the crisis, we were on a learning curve and we were trying to understand what things would look like. Would we get more patients? How sick would they be? Would we have the resources to take care of them? So we had to learn how to take care of something that we had never encountered before. Good morning. I'm heading into work. It's an absolutely gorgeous day. The sun is shining. Unfortunately, ever since this all started, I've had terrible insomnia. So I find that I do my best thinking between 1:30 and 4 a.m. So I was already perusing the hospital census, and I know that the hospital is not terribly busy, but things are picking up. I'm gonna get in here and start the day. I've got my mask ready, and as soon as I hit the door, I'll have to let everybody know that I don't have a cough or a fever or shortness of breath. Get my temperature checked and head in to meet my team for the day. Okay, so wearing the cloth mask around the hospital is a little uncomfortable. I just went up 3 flights of stairs to come up to the intensive care unit, doing some rounds on our patients today. And I know that I'm gonna have to go see one of our patients with COVID. So I'm hoping that he's doing well this morning, and I'll need to put on all my gear after I check in with the team. All right, here we go. Normally we just use these once, but right now we have to use them in a very conservative way so that we don't run out of the PPE that we need. So we're taking extra measures. Covering them again, surgical mask. Even though I'm wearing glasses, I still need a face shield, a couple different gowns as well. Whew, I'm sweating already. All right, in I go. Today's one of those days where I'm trying to balance being a mom and a doc and do a good job with both of them. So I'm taking a break from rounds to go ahead and join in my son's preschool Zoom meeting. I know we all have to stay home right now, and that's not been very fun. But remember, if we stay home, we stay healthy. But we miss all of our friends, right? Thumbs up if you miss your friends. Yeah, we'll get to see them again soon.
It has been a few weeks since your first video diaries. What has changed since then?
We're experiencing exactly what we predicted, which is a wave that came up after the loosening of the guidelines. Right now, in the middle of June in northern Lancaster County, we are appreciating a huge spike. Folks were afraid to seek care for a while because they did not want to come in contact with the coronavirus. So that interruption in care of chronic comorbid states has led to those comorbid states getting out of control. We've also seen a huge uptick in substance abuse. Folks who are in either withdrawal or looking to detox, looking for care for that, and significant decompensation in mental health care. So folks' well-being has played second fiddle, and that has really hurt our individuals who struggle from a mental health capacity. Good morning. Getting ready to head into work for a regular day at the hospital, but a regular day at the hospital could mean a whole lot of things. Sitting at the kitchen table, putting makeup on. This lets me talk to my family and talk to my husband in the morning while we're all getting ready. So he's having a bowl of cereal and making me a cup of coffee, and I'm almost ready to go. Kids aren't awake yet, but we're expecting them any moment. So heading to the hospital where we know that there has been a recent uptick in our number of COVID patients. This paralleled to our transition from red to yellow in the county, but it also paralleled to a whole lot of folks loosening a little too much on the guidelines. Folks have just kind of gotten a little too laxed. So that's giving healthcare providers quite a bit of angst, myself included. So I know that the census is high at the hospital. I know that the percentage of those patients that have COVID is a little bit unnerving. So with that, we want to make sure that we have enough protective. Hi, here's one of the munchkins. Good morning. How are you? Mommy has to go to work today, okay? But then I'll be back as soon as I can. Okay. All right, off to work we go.
Have you felt concerned about your own health while treating COVID-19 patients?
My own personal approach has been that I have never felt uncomfortable or fearful. I've taken extra precautions. My kids, I used to come home from work in my scrubs, and the day went on, no big deal, because I've never classified myself as a germaphobe. But now I come home and my shoes stay in the garage, and the kids know they can't touch me. You know, the scrubs go in the wash, and I take a shower. It's worth it to make sure that I'm protecting my family. I think it would bother me less for me to be unwell, but to have to ask my husband to get tested and be worried about him and be worried about his health, that adds an extra layer of angst.
What are your concerns about COVID-19 right now in this moment?
If folks are getting away from masking or hand washing or social distancing, they're going to come in contact with the coronavirus and unfortunately have a higher likelihood of being admitted to the hospital. And if we do not continue social distancing, hand hygiene, and very, very, very importantly, the masking, we're going to continue to see this increase, and we'll see an increase in morbidity and mortality as well.
What do you think you'll take away from this time?
When I look at my 4-year-old and my 5-year-old and say I'm raising my children in the era of a pandemic where we have social unrest, where we have political unrest, and they're young enough that they're not going to remember a whole lot of this, but I'm going to remember a world before that and a world after that, and it's going to look markedly different.